So our topic for this evening will be basic principles of relapse prevention. Before we start, I would like to say that wherever you may be currently in your journey with either therapy or self-help, whatever way of helping yourselves you've decided on, this can be beneficial in the sense that it will give you an overview of different components that treatment should probably include and different areas of your life that might need to be adjusted or changed somewhat. So even if you're not in that place in that place yet where you need relapse prevention, you can think of this as a way to digest or distill the most important aspects of treatment, at least as I do it and as it is done at SkinPick. So here are some topics that we will discuss this evening. We'll talk about why and when is the right time to think about relapse prevention, and then obviously explain what that is and what it entails. We'll talk about different ways to deal in relapse prevention with triggers and risk factors. We frequently talk about them and then lump them all into one. But when it comes to relapse prevention, it is important that we separate them. So this distinction isn't always meaningful, but here, when it comes to relapse prevention, it is. We'll talk about what techniques you need to pay attention to and how to select appropriate techniques for relapse prevention and the role of discipline in this. Don't worry, I will not sound like a school teacher. Then we'll talk about first aid techniques, which are those techniques that you use when you suddenly feel the urge. So something that is always very close to you, very easy to apply. We'll talk about selecting and implementing these, and of course, what their place is in the overall scheme of things. And then we'll talk about some deeper work that perhaps can be done that requires obviously more time but the kind of work that will be very helpful, first of all, to know where you are and how likely you are to pick, to maybe see ahead and anticipate when you might need to use these things that you will learn in relapse prevention. And then, of course, by resolving some deeper underlying issues, you're obviously dissolving a lot of these risky situations or even dealing with reducing or perhaps dissipating the urge in certain areas even forever. So that's the kind of work that takes a long time, but it is definitely something that's worth investing your efforts in. I'll just briefly mention that in the end because that I think deserves a topic of its own, since it's quite a wide net I'll be casting there. So let's start from the beginning. So why do we need relapse prevention and when do we need it? It's the right time to think about relapse prevention is when you've achieved a significant reduction in picking, or at least the reduction that you're happy with, or when you stopped picking completely. Then it's time to create and start putting in place your relapse prevention plan. I emphasize the word plan here, and you'll see why soon enough. So relapse prevention is essentially a way to preserve the progress that you've made. Relapse prevention will allow you to take appropriate measures in a timely manner, so it allows you to be proactive. But if you're starting treatment right now, then you don't need to think about relapse prevention just yet. In fact, I would argue that even if you've stopped picking right now without any significant therapeutic interventions, just spontaneously, it nonetheless may not be the time to create a relapse prevention strategy or a plan, because one thing that in order for you to create a selection of techniques and changes that you need to implement into your life, you need to try different things. So you need some experience with a variety of techniques so that you can assess them properly and then put them in place. if you've spontaneously stopped picking and haven't done much to try and stop it, you can still think proactively. In fact, it's a very good thing to think proactively. But some of these things and instructions that I will give you might not apply to you simply because you perhaps haven't tried sufficiently so that you can take that experience and then create a relapse prevention plan. So I emphasize the word plan, and this is like the third or the fourth time in these couple of minutes that I've said it, uh, because this is something that you shouldn't just think about. It's something that you should really put on paper. Either write it down. If you have a journal, that's a good place to assemble your relapse prevention plan. What I like to advise people is to somehow represent it visually. So if you know how to do mind mapping, for example, that can be quite useful because a plan is supposed to put a lot of stuff in, and it's supposed to be easily readable and easily visible. So in our program in SkinPick, we have different worksheets where you elaborate on specific aspects of your relapse prevention plan, but you don't need worksheets. You can simply take pieces of paper for each of the categories that I will talk about. Take a piece of paper, assess your experiences, think about them, journal, recall what it was, review your journals, whatever you need. And then based on that, create something. And then in the end, create a visual representation of it. I know that this may sound like a lot of work to put in, but it is worth it in the end. Because the idea behind relapse prevention is to distill everything that you know about picking, everything that provokes it, everything that alleviates it, every technique that helps, and then put it in a specific order so that you know what to do when you can anticipate a risky situation, what to do on a daily basis, regardless of whether or not you feel triggered, how to recognize whether you will feel triggered, and then what to do in those urgent situations when suddenly urges come up, maybe even unpredictably. So there are quite a few components in every relapse prevention plan, hence why you need some way of arranging it logically. On the other hand, as I said, if you're not there yet, if it's not the right time for you to create your relapse prevention plan, you can take these categories that I will talk about and then see how you can implement them in your everyday life, experiment, find different ways that would work for you, or introduce them into your therapy as well with your therapist. So we can think of relapse prevention as having at least several components. I will talk about 4 or 5 of them today, although if you want to be even more detailed, you can break it down even further, but I think having these few major categories is a good place to start. So we'll talk about mindfulness or being aware of picking. We'll talk about self-care. We'll talk about different precautionary measures that you can take. We'll talk about coping strategies, and we'll talk about first aid strategies. So these are some basic components that you should have in your relapse prevention plan. If you're doing, let's say, if you want to represent it graphically, I like mind maps for these things. Basically, you would put relapse prevention at the center of your page and then devote a branch to each of these. And then think of different ways in which you already know from your experience that you can implement them. And I will explain what each of these entails now. So by mindfulness here, I don't necessarily mean meditation, although if you want to meditate daily, by all means, I can't encourage you enough to do that, but that's not what I mean. What I mean by mindfulness here is what's meant by mindfulness, let's say in acceptance and commitment therapy, which is this kind of awareness of what's going on, knowing what you're thinking about, knowing what you're feeling, knowing how your thoughts and feelings influence each other and how they get you to interact with your environment. This is something that we work on explicitly when you work on awareness training, for example, in habit reversal training, except that there mindfulness is limited to different facets of picking. But when we talk about being mindful more generally, for example, right now, I'm sitting here, I'm very much mindful of my throat being sore because whenever I say something, I feel the pain. I'm mindful of the air conditioning above me because I can feel it like in this area of my head here. I'm thinking about whether or not my voice will crack before I finish the webinar. Um, I'm feeling quite relaxed, surprisingly. So that would be mindfulness, knowing what's going on inside of me and around me. Meditation will certainly facilitate that, but that's not the only way to achieve it. You can create little check-in moments for you throughout the day. If you work, for example, and get absorbed in your work, and then somehow start picking mindlessly while you work, then it's useful to identify specific check-in points throughout your workday, or at least those parts of your workday that are particularly risky or difficult. And then pausing, it's sufficient to pause for like 30 seconds. You don't need to spend 10 minutes assessing what you're feeling. Just see what you're aware of right now. That's basically what you need to do. Think, what do I feel? For example, if I want to identify how stressed I am in a given moment, I don't have to check in with every single aspect of my experience, because and you should know this by the time you finish any kind of therapy. For example, I know that I need to check with my shoulders, my chest, my abdomen, because me and most other people will feel stress in those areas. I've also noticed that if I sit for a very long time, my legs become restless. So that's something that I will also pay attention to. That takes 5 seconds, and it will give you a decent insight into how stressed you are. As you all know, the higher your stress levels are, the more likely it is that you'll end up picking. So by being mindful, you can kind of assess where you are and then change your course of action early enough so that you never get to the point where you need to pick. Obviously, this is not uh, having those moments to check in throughout the day is easy enough. You can set your alarm, but this is not something that you should do only when you're in therapy and reducing picking. This is a skill that is supposed to be cultivated even after you finish therapy. In fact, I would say that this is not only the basis for doing therapy, this is also the way that we're in a sense meant to live. So you're not meant to become mindless at any point. So this is the backbone of your relapse prevention plan. If you lose your mindfulness, you won't remember what to do in risky situations. You might lose sight of any kinds of the kinds of routines that you need to be implementing every day. If you decide that you want to do a breathing exercise every time the urge starts showing up, if you're not mindful of it, your plan is basically worthless. So this is the beginning, and this is the core feature of your therapy and then your relapse prevention. So you can do that in different ways. You can meditate and then try to extend that feeling after your meditation session. You can have these little check-in moments throughout the day. You can simply choose to focus on one aspect of your experience throughout the day. You can set an intention at the beginning of your day that you want to be aware of your thoughts, for example. Especially because one thing that we do in therapy is redefine how we relate to our thoughts. So that's also a good way to practice cognitive diffusion techniques from acceptance and commitment therapy, just to give you an example. So when I teach mindfulness, for example, I will give these little assignments to my students because I teach them how to sit and meditate or lie down and meditate, but I like to teach them also how to extend that into the rest of their lives. So I will give them assignments when to be mindful during their day, and then I will rotate these assignments weekly. With this, I achieve that they're always vigilant about their internal experiences. So one day I might say, every time you pass through a doorway this week, you should pay attention to your chest, or I don't know, pay attention to your thoughts. And if you move, you are bound to pass through a doorway or two every now and then they will have to pause and be mindful of what's happening. The next week I might rotate this and say, every time you take a sip of water or tea or any kind of liquid, be mindful of your thoughts, or just feel the taste of what you're eating or drinking. So I will rotate these assignments because overall that teaches them to pay attention to bigger and bigger parts of their experience. But being mindful in one way or another has to be included into your relapse prevention plan. Just keep that in mind. If you're in SkinPick, you will have a whole session on mindfulness, and including this mindfulness without meditation. So you should learn a few tricks along the way. Then you can review what you've tried and then take what works best, uh, even if it requires you to reorganize your routine. So frequently I will have clients who conclude through, at the end of our program that, for example, actually sitting and meditating is the best thing for them, because when you meditate in the morning, it's likely to make you mindful throughout the day. And then just today, for example, one client wrote to me and she said that she realized that meditating in the early afternoon is the best way for her to stay mindful, because when she wakes up and starts her day, she's able to maintain a degree of mindfulness. She's mindful about using her techniques. She's mindful about paying attention to her workload and all these things that are important for her. But then at the second half of her day, in the evening, she gets tired, because even when you're mindful of work, you still get tired from working. And then if she meditates in the early afternoon or early evening, that resets her and then adds a little bit more mindfulness for the rest of her day. And so she identified this when we were working on relapse prevention as being the best way for her to stay mindful of her feelings and thoughts throughout the day. But then she said, yeah, but I can't find 10 minutes in the afternoon to meditate. Everyone can, of course, find 10 minutes to meditate. For example, you can scroll through Instagram 10 minutes less, and there you go, voila, 10 minutes to meditate. But my point being is that you might feel reluctant to incorporate some of these things because they require lifestyle changes, or at least changes in your existing routines and schedules. This is not always easy, but it is a necessary evil. So one change always implies another change, and so on. So you can't change just speaking in isolation from everything else. So try out different ways of cultivating mindfulness or awareness, or however you want to call it, and then make sure to implement it regularly. So you don't need 10 ways. One is enough. When we do relapse prevention, we want to select the best skill that we have, something that is applicable in most situations, regardless of what our routine is like, something quite flexible, because you want to create a plan that is useful in, if not all, then almost all situations that you may find yourself in. So that would be the first component and the core. Then, and also a long-term one. So being mindful is not something you do every other Tuesday or when you have a difficult meeting. It's something you do every day as much as possible. Needless to say, that will enrich your life in many different ways, but here we just limit ourselves to talking about picking. The second important category is self-care. And when I say self-care as a part of relapse prevention, I really don't mean scented candles and whatever else. Like, I don't mean those, things that they sell you on whatever lifestyle website. That's not at all what I mean. If that's your thing, by all means, knock yourself out. I don't mean that you shouldn't do that, but that's not what I mean here by self-care. By self-care, what I mean is changing the way your daily routine is like, what other habits you have that might not be healthy, and in general, adjusting your lifestyle so that you minimize those risk factors that that might make it more likely for you to pick. So, for example, if you have a very sensitive skin, then figuring out a good skincare routine is fundamental. Having anything on your skin will be triggering, and even with all the techniques that you might have and all the stuff that you do, it's still an unnecessary provocation. So you might not be able to make your skin perfect, because no one has perfect skin, but do the best you can. If necessary, even consult a dermatologist or a cosmetologist or someone who can recommend something structured and evidence-based for you. So a good skincare routine would be an example of self-care. It's both caring for your body and it's also caring about your psyche. If you are overworked, I will take a free guess and say that most of you are, then stress management is something that is a form of self-care. Anxiety management as well. We can talk about self-care as cultivating attitudes that increase your well-being, such as self-compassion, forgiveness, acceptance. All these sound very simple, of course, but they are not. Self-compassion just means the kind of teaching yourself uh, or cultivating the desire to alleviate your own suffering. So when things get tough at work, or if you have kids and they're particularly impossible that day, it's not telling yourself, I'm a horrible parent. It's saying you've done the best you can. Let's rest now and then learn our lessons for tomorrow and do differently. So it's self-compassion you can practice it also through meditation, but in a kind of wider sense, just means not being, pardon my language, but just not being an ass to yourself. Very, very frequently, my clients talk about self-compassion as treating themselves the way they would treat their friends or loved ones. Because it's much easier for most of us to be compassionate to other people than to ourselves. So maybe that's a good way to think about that. If you want to learn about self-compassion, I can recommend some resources, and I can create a list of resources and then email it to you. You'll get my email in the end, so you can ask me for it. You can also go to selfcompassion, I think, .org. It's a website by a self-compassion researcher called Christine Neff. She offers some exercises and guided meditations, and she also has one book. She has another one out right now, but I haven't read it yet. But her workbook on self-compassion is something that you can work through on your own. Forgiveness just means not holding a grudge against yourself. And of course, acceptance, meaning seeing clearly what it is that's happening, even when what's happening inside of you or around you is highly unpleasant. And the reason why acceptance as an approach to your experience is a form of self-care is because acceptance opens up the space for you to actually change something. Acceptance, in the way that I define it, means seeing things as they appear to you. If you see yourself as being, I don't know, weak, for example, because you feel like picking, then acceptance is seeing that need for picking and trying not to judge yourself as weak. You can see the judgment, keep it somewhere close by, but don't cling to it. It's just seeing your need to pick right now. Because if you want to resolve that need in a healthy way, you have to be able to look at it. So that's quite an art. It's not at all easy. Because then you look at what you're feeling, you focus on the bare sensations, and then for each of them you ask, what can I do to reduce this right now? So that would be an example of how to practice acceptance. So all these are more or less skills that take time to develop. Hence, self-care, like mindfulness, being a long-term project. So even if this is a part of your relapse prevention plan, it is a part that is always in motion. So you always apply these. And you apply both mindfulness and self-care even in situations where you're not actually triggered to pick your skin. If you don't have compassion in that aspect of your life, chances are you don't have compassion in others as well. If you're a perfectionist, for example, you have ample opportunity to practice stress management, anxiety management, self-compassion, forgiveness, all of these, right, in most areas of your life. Another aspect of self-care that is typically quite painful for people is acknowledging your own boundaries and limitations. That means knowing what you can't do and not asking yourself to do more than you can. This sounds, again, simple, but I don't think I have ever seen a client who accepted the idea of having limitations easily, especially because the particular limitations that we need to pay attention to are those limitations that in areas of our lives where we care about the most. So if you have to work 12 hours a day because you're chasing after a promotion and you keep picking more and more, there's a limitation there. It might not be permanent, might not be forever. There might be other ways for you to get to where you want to go, but working 12 hours a day might simply not be something you're capable of doing. So making peace with that, and then seeing how you can work productively within the boundaries that your body will allow for. That would be acknowledging your boundaries and limitations. Psychotherapy is also a form of self-care. So typically, because CBT is the main therapeutic modality that we have these days, people usually go to psychotherapy and say, I have this symptom, let's work on removing it. But psychotherapy as such, especially psychodynamic psychotherapy, constructivist psychotherapy, it can offer a lot more. It can be a very good check-in point for you once a week or once every 2 weeks, so that you assess your life, see where you are, kind of work through any issues that arise. And not to mention that, most people have some issues that they need to deal with anyway. So psychotherapy is an excellent form of self-care, at least when it comes to mental health. Even if you don't have any acute issues in your life, it's a very good way to learn about who you are, what your values are, where you want to go, and to be at ease when you reach those boundaries and limitations, and to say, it's fine, I'm still good. So that psychotherapy, highly recommended, of course, providing you can afford it, because unfortunately that is not a cheap service. And then healthy lifestyle also figures in here. If you're overworked, that's not a healthy lifestyle. If you work a sedentary job, not a healthy lifestyle. So that needs to change. So self-care is kind of a chunky one, in the sense that it is something that will affect nearly every other area of your life. Again, these are some examples. You might have your own examples that specifically work for you. But what's important to remember is that you shouldn't do these all at once. If you choose 5 things to do from every category that I mentioned here, you will create a plan that in itself will be stressful. So rank these, add some more stuff that comes to your mind, and then see what's most important. What contributes to picking and frustration and stress the most, and then focus on that. And then maybe choose another thing that you can do if you have time. But choose one that will be most effective. I think most people know this quote by Rumi. He says, never give from the depths of your well, but from your overflow. This refers to boundaries and limitations, but only in interpersonal context. So when one thing that I've noticed in our support groups over the past couple of months is that one topic that seems to be coming up consistently is how much people care about what others think of them, in terms of, to put it plainly, people pleasing. That is one aspect of setting boundaries and acknowledging limitations that I wanted to set aside specifically. It's a very good self-care project in the long run, to work on finding different ways to validate yourself, so that you don't depend on the validation of others, because only then you can give as much as you can give without hurting yourself. So the boundaries in interpersonal relationships and communication styles, like assertive communication, for example, can be tremendously beneficial. And they also belong to the realm of self-care, because they will affect other areas of your life and transform them for the better, not just skin picking. Now we move on to precautionary measures. I mentioned risk factors, and I also mentioned that we will differentiate between triggers and risk factors. When we can call them either way, it doesn't matter, but here it does. A risk factor is, for example, stress or anxiety, or sometimes menstrual cycle also. So it's anything that might appear in your life that is likely going to is going to facilitate the urges, make them more likely to show up. Those would be risk factors, and those we want to mitigate by using self-care. You might want to meditate daily so that you reduce stress. By reducing stress, you're reducing the urges, also as a consequence, because urges are more likely to arise when you're under chronic stress. So by addressing chronic stress, you're addressing the urges indirectly. Whereas triggers are those thoughts, feelings, uh, people, events, can be anything that will immediately trigger picking. So risk factors are the fertile ground on which urges might arise, and triggers are like direct seeds, causes of the urges. So when we talk about precautionary measures, we're talking about finding different ways to minimize, reduce, or otherwise deal with your triggers. Some examples of this would include what we call stimulus control techniques. So if your skin triggers you, maybe in some situations you may want to wear gloves. That is a good stimulus control technique. If you pick while you drive, holding both of your hands on the steering wheel is again a good example of stimulus control. So wearing the gloves or keeping your hands on the steering wheel would be examples of precautionary measures. Those are things that you undertake in situations that are otherwise risky. Even if you feel well, even if you don't feel that you're particularly susceptible to picking, you should have these for every major situation or every major trigger, and you should use it consistently. If you had the fortune or misfortune, that depends, I guess, on the day and the client, for me to be your therapist, you know that I always insist on this, that you find the smallest number, the fewest techniques that work in all or almost all situations, right? And I always insist that they're used consistently because they're supposed to become habits. They're not supposed to evaporate from your life once you finish our program and decide that you reduce your symptoms. But you also don't have to use every single thing you try in therapy, because over the course of your therapeutic journey, you will try dozens and dozens of different techniques, and there's really no need for you to keep all of them. It just causes confusion. Relapse prevention plan is supposed to be clear and easy to apply. So if you have 25 precautionary measures that you're going to take, I can guarantee you that this is not going to work and it's not going to be successful. So if you have 2 or 3 situations that you pick in, or let's say 2 triggers that are particularly difficult for you, then you will find 1 or 2 precautionary techniques to use, and you will use them regularly. Other than stimulus control, that can entail, for example, learning to say no. If being overwhelmed by work or, I don't know, demands of your friends or people around you, uh, then learning to say no would be an excellent precautionary measure, because once you identify that, let's say, it's hard for you to say no to your partner about, I don't know, whatever they want to do, learning how to say no when you feel stressed and overwhelmed. So you're being mindful and you understand where your stress levels are. Your partner is approaching and is about to ask you something. You understand that this is a triggering situation. Learning to say no is your precautionary measure. You can even say no before you hear what it is that they're asking. But learning to say no, unfortunately, isn't easy for everyone, but it is an excellent precautionary measure. Learning how to tolerate difficult emotions is also an excellent precautionary measure, because one way in which we conceptualize excoriation disorder is as a way to avoid processing difficult emotions, thoughts, or memories. So learning how to do that is an excellent way to make triggers less triggering. Again, as you go through the kind of treatment process or any kind of self-help process that you're going through, this is you select what works for you, not more than 1 or 2, and then use it diligently. One note here, though: if seeing skin changes like acne or anything else, like KP or whatever, triggers you, wearing certain clothes in specific situations can also be a precautionary measure. You can also learn how to be mindful of your hands. That can be a precautionary measure in itself. And if you're triggered visually by seeing your skin, sometimes in the beginning of the program, when we work on habit reversal and stimulus control, we will use techniques like covering your mirrors. This is not always the best thing to keep once you finish the program or after some time, because it is very difficult to live with all your mirrors covered consistently all the time. And if you ever travel, you might not be in the position to cover mirrors in a hotel or something like this. My apologies. So one thing that you can do, and that's very useful to implement, is use a stimulus control technique like that while you're in treatment. That's perfectly fine. And then, let's say in the last couple of weeks of treatment, start transitioning to a less demanding stimulus control. For example, you can learn how to stand farther away from the mirror. Because if you're going to put on makeup, if you think about it, you never put makeup on so that people are this far from your face, right? They're going to stand at a certain distance from you. So in that sense, if you stay farther away from the mirror, you can still achieve the desired effect, do everything you need to do, and you will be less triggered to pick. Standing far away from the mirror is maybe better even than dimming the lights, because is it applicable wherever you are. Your own bathroom, your, I don't know, parents' bathroom, hotel, car, whatever. You can always stand farther away. Using a timer is also a very useful thing. There's also one other thing that you can do, although I would advise you to, when you practice it, to practice it with someone else. And you can do this even as part of habit reversal, which is kind of learning how to accept what your skin looks like. So take a mirror, have someone you trust close to you, and then observe your skin for 30 seconds. But don't focus just on the problematic areas and the flaws, but try to see all of it together, the good and the bad, and to balance it out in your visual field. And then stop. And then come back and practice some more later on. Slowly increase the time you sit and observe, and always have someone that you trust close to you, because you might be tempted to pick. So it's important to have an accountability partner, because in the long run, that way you're learning how to look at imperfections and not respond to them by picking. This is an excellent precautionary measure to take. So these would be some measures to address the triggers. So we have mindfulness to know what's happening and to recognize risky situations. We have self-care to deal with the risk factors. We have precautionary measures to deal with specific triggers. And now we're going to talk about specific techniques and discipline, and then we'll finish it off with first aid techniques. So once you start creating your relapse prevention plan, I suggest that you take a piece of paper, or if you're typing that in somewhere online or in the worksheets, list everything that you've tried. So every competing response, every mindfulness technique, every breathing exercise, grounding exercise, cognitive diffusion, relaxation whatever you've tried throughout the program, and then rate them in terms of how effective they are. Not in terms of how easy to use they are, how much you like them, how much resistance you feel towards them, none of that. Just how effective they are. Then rate them again in terms of how applicable they are. Can you use them everywhere, or can you only use them in specific situations? And then find the best combination of the two. This is really very important, because if you competing responses, so those techniques that you use to replace picking with, are meant to be habits. I cannot stress this enough. That means that even when you're done with the program, you should continue to use them and practice them, which is why I always advise people to find only one or two that work, if that's possible, and then also to find responses that they actually enjoy using. Here on the picture, you have the Baoding balls, those like Chinese meditation balls. They're a very good competing response, especially if you have, for the lack of a better word, nervous hands and fingers, and if you feel like your hands have to do something and move. Baoding balls are very, very useful because they exercise your muscles and require you to focus. So they will give you some of that focus and an ability to just reduce your world to one activity that picking does, like the trance-like state. But then at the same time, they will give you a little bit of exercise to release the energy that you have pent up in your fingers. I see that some of you are raising your hands. If the question requires a detailed answer, you can email it to me. If not, just type it in here, and then I will respond very quickly towards the end. If you'd like me to explain what these are and where you can get them, that's no problem. Just type the question. Should be easy. So when you try 5, 6, 7, 10, 15, different competing responses, you might find that 10 of them work. But the trouble with this is that to establish and maintain 10 habits, that's really very difficult. And if these 10 habits include different toys and different like stress balls and stuff like that, it's very likely that at some point you're just going to give up and not be motivated enough. This is why I suggest 1 or 2 competing responses and something that you like using. Like, let me give you an example of something that is quite functional, like this cube here. Like, it's very soft. I don't know how to, I've shown it before. I quite like it. So it's soft. It's like a stress ball, but not quite. And it's really lovely. It has this nice texture to it. So this is an example of a very functional competing response for me because I like playing with it. So even like if I'm doing nothing or just reading or sometimes even talking to people, having meetings, I'll just squeeze it and play with it because it feels good for me. It's interesting. So because I like using it, that will make it an excellent competing response. Because if I enjoy using it, that means that it's more likely to become a habit. As you can see, it's quite beaten up, so it has been used. Oh, I see that someone is saying, what is the ball that you mentioned for active hands? It's called a Baoding ball. I'm going to type the answer to the person who asked in case my Chinese sucks. I know how to spell it. I'll send it privately because this person wrote their name, so I don't want to make it public. So these are quite cheap. You can have some that make sounds, which I don't like, but you might like. And then you can have some made out of solid steel, which is the pair that I have, except that they're downstairs, so I can't show them to you. And basically what you do with them, you put them in your hand and then you rotate them. So I use the ones that are made of steel, so they're quite heavy, which makes me aware of my hand at all times. It gives my hand a good exercise. And also I have to be very, very focused because once or twice I may have gotten distracted and then they fell out of my hand and onto my foot. And because they're quite heavy, I make sure that that never happens again. So I'm very much focused when I use them. So for example, for me, that would be a good competing response. Another thing that you can have is something like this. This is it's called an infinity cube. You can basically buy it in any color. And it's something that you can assemble and reassemble into a cube in like several different ways. You see, like this. This is also something that I personally enjoy playing with. So this is why I'm giving it as a recommendation. If you have 1 or 2 like these, you can buy several pieces, keep them in any situation that is maybe difficult for you. Sometimes if you need something to carry on you, you can use like some sort of prayer beads or mala beads or a rosary, because that's something that you can wear as jewelry, but it's also something that you can fidget with. But the idea is to have a small number of them. So you can buy 10 pieces, but it should be 1 object, if that makes sense. Right, so, and then you use them. If you have trouble narrowing down your competing response, because this does happen sometimes, that people will find that one response works here, but the other one works here, and then they need 6 or 7 of them, and then sometimes they get bored and want to replace. What we want to achieve here is to make them habitual. So they're supposed to be habits. In that sense, we can maybe cheat our way out of this by creating a self-soothing kit. I don't have time to explain in detail how to do that, but I can send you the instructions if you want. Again, so you can just email me when you get my email in the end, and I will send you the instructions. Essentially, a self-soothing kit is like a box that contains different competing responses, kind of motivational messages, different kinds of items that will help you deal with those specifically difficult situations. What you can do is you can create one or even several self-soothing kits and then keep them in risky places and play with them regardless of whether or not you're triggered. So you just open up the kit and find whatever works for you in that moment. That's also one way to approach this if you can't decide on one response. But try not to say, I will use this for this situation, I will use this for that one, and then create a schedule for yourself that you can follow. So just keep it as simple as possible. Because remember, we're thinking about long-term use. And then in the end, there are the first aid techniques. So these can be any of the techniques that I've mentioned before. However, what you can select for your first aid technique, and you should really have one first aid technique. This is something that works even for the most intense urges. It's something that you can also keep on you or close to you at all times, like in your purse, in your backpack, and I don't know, in your car, office, wherever. So something that you can always have near you in case an urge comes along that is so intense. So you need to have something that works well. So I tend to prefer techniques using an object like those that I showed you. Simply because an object is also a reminder. Like if I have this in front of me, it's really hard not to notice it. So if I'm feeling, I don't know, stressed or anxious or something, and I see this cube next to me, I can very easily grab it and then just start playing with it. This cube, I would say, is a good first aid object for one specific reason. So this infinity cube, if you play too much with it, like you can only bend it in certain directions, and that's about it. This one, however, will take any aggression that you might have. So if you need to squeeze it really tightly to get anxiety out or even anger, if you want to rotate it, you can do whatever you want with it. It will return in its original shape very quickly. So you can essentially beat up this little cube and get all that energy out. There are some other things that you can use as first aid and that work well, such as breathing exercises, like box breathing. I can also send you instructions for these and the video guidance. Just email me and I'll actually prepare an email with all these resources. And then if you want me to send it to you, I will give you my address and I will send them to you tomorrow so that you can have these and try them out. So box breathing, for example, works well, and it'll take about 4 minutes to alleviate quite a significant chunk of tension. So that can also be your first aid technique. Another very useful, I have a guided meditation that I prepared for some of my clients. It is a little bit longer than box breathing, but it's essentially a combination of mindfulness and relaxation and grounding and some physical exercises that I've picked up on over the years. And you can, for example, play that and then use that as a way to calm down once an intense urge arises. These things like breathing exercises and the exercise that I mentioned, that I can also send you since I have the recording of it, they have a downside, which is that you need to remember to use them. And sometimes when you're overwhelmed, it's really difficult. Like a breathing exercise, if you know the rules, if you've memorized it, it's fine. But if you need to play a guided anything, it might be too late. It might be too much work to get started, and you might decide in the moment that it's simply easier to pick. Which is why first aid should be something that really doesn't lend itself to rationalizations like this is taking too long or this is too complicated. It should be something very simple. I've had a client whose first aid technique was screaming. And when she suggested this, I thought, well, that sounds a little too much, but it worked very well for her because no matter what else she would try, it was kind of hard to get her, because she was triggered by anger and frustration, especially the anger and frustration that she doesn't communicate to anyone. And then when she would yell or scream, this would be very helpful because she would get all that out, and that would make the urge go away. So that's another way. Maybe, cognitive diffusion techniques could work, but I would stick to something that is a physical object, something that you can squeeze, touch, rip apart. You can find a piece of paper and then just rip it into smaller shreds. That's also quite good. Anything that doesn't cause any permanent damage. But the best way to find what works for you is to simply select the most efficient competing response you have. So even if it's not that easy to apply, for first aid, it just needs to be quickly available and around you. That's the only measure. You have some things like, for example, as you can see, I'm surrounded by different competing responses. You have these things like, how do you call them? Worry stones, but I think they're better as competing responses than they are as first aid techniques, because the texture can be really nice and relaxing if the sensory aspect of picking is important to you. Rubbing it is relaxing in itself, but it's never strong enough to be a first aid technique. So first aid techniques shouldn't be subtle in any way, should be quick and aggressive. You can also have a person that you call. That it's kind of rude, I guess, to say that a person can be a first aid technique, but you can have an accountability partner, which can be either someone you love and trust, or maybe another person that struggles with picking, and they could be there for you. And then a phone call that lasts 5 minutes from someone that understands what it means to feel an intense urge can be really useful. And then they can also guide you through a breathing exercise, for example, because when you have another person helping you, you're much more likely to be compliant. So that's also something to think about. And then in the end, as I said, there's the deeper work. By this, I mean addressing the underlying causes of picking, but not underlying causes as in, I'm just anxious, so I need to do mindfulness to relax. I mean exploring really the roots of that anxiety, like where does it come from? How was it created historically? How has it changed through your life? Just really trying to find a way to heal. For example, people will say, I'm a perfectionist. I need to learn how to do things in a less perfectionist way, which is, of course, possible to do. But with perfectionism, the question is more this kind of deep lack of self-worth and self-love. So that would be the deeper work that needs to be done so that the behavior goes away or becomes benign. It often involves exploring personal relationships and boundaries, questioning your friendships, your relationships with your parents, your partners. I see daily at least several clients who pick in order to mitigate their anxious attachment to their partners, for example. And then addressing those attachment issues would be the deeper work that needs to be done. Because a relaxation technique is not going to get rid of an attachment style. An attachment style is something that we develop very early on when we're young, and we develop it through relationships with our parents. And we all know that when we get to that point in psychotherapy, that's the point where there's a lot of heavy lifting to be done. So that would be the deeper work there. If you've experienced traumas or have any other issues, that would also be the deeper work. The reason why I put that in the bracket of relapse prevention, even though it's obviously a journey unto itself, is because by working through this, you will also be aware of picking. So you can't work on a trauma that causes you to pick sometimes, without having picking in mind as well. So working on these issues with a therapist or in any other way that you see fit will also help you deal with picking, and it will also keep picking in your mind, because those moments when relapses are very likely to happen are moments when we stop being mindful, when we stop thinking that it's a possibility, when we become maybe cocky and say, well, I haven't picked in a year, so I'm done with it. So I don't need to be mindful anymore. I don't need to take care of my stress anymore. Screw living healthy and having a routine. That's when a relapse will happen. So in that sense, as long as you work on something that is intimately related to skin picking, you are actually preventing a relapse. Not to mention that resolving these issues will obviously decrease the urges overall. One thing that I would kind of advise you not to expect and not to work on is never to feel the urge again. Um, I think it's very debatable whether or not that's at all possible. It's akin to saying that an anxious person should come to a point when they're never anxious again. That's just very, very unlikely. We uh, we experience all kinds of feelings, and we very frequently cannot control what we feel, especially as we're feeling it. Like if you're feeling anxiety, you can't tell yourself, I choose not to be anxious right now, because you're anxious. That's it, period. So you have to accept your reality and then work from there. See how you can make it better or make it easier. And the same thing goes for urges. If your goal is never to feel the urge again, I'm afraid that you might be kind of setting yourself up to fail, because you might feel like you've failed every time the urge appears, regardless of whether you pull. Uh, the urge is kind of an alarm that your psyche is sending you. Uh, so, in that sense, that alarm might go off from time to time. But that alarm always points to a danger somewhere. It points to something that needs to be dealt with, a need that needs to be attended to. So think of it as an invitation to dive in deeper and understand yourself. Naturally, if stress is causing most of your picking, if you work on sources of stress, if you work on balancing your work and life, if you find ways to mitigate that stress, you will not have as many urges. But there will be situations in your life that will be stressful. And I would also caution you against wanting to come or expecting to come to the place where you will never again think about picking. And this is not because I think picking is different than any other issue people deal with. It's simply because once something becomes a part of our repertoire of behaviors, it will occur to us to use that behavior again when we find ourselves in a similar situation. If if let's say if drinking when you're anxious is something that you do, you can stop drinking, you can stop using alcohol in any amounts at all. But if you find yourself among people who have a glass of wine in their hands, and if you find yourself anxious, it is highly unlikely that at least a thought about of drinking won't come through your mind. And the same thing goes for picking. If you've picked for 10, 15 years or whatever, and you find yourself in a stressful situation, the thought of picking will cross your mind. But one thing that you do then is learn how to treat your thoughts in a healthier way. We do that in our program through cognitive diffusion and mindfulness, where you learn to treat your thoughts as just kind of transitory mental phenomena, not reality, not the truth, just something that your brain proposes and that you don't have to listen to anymore necessarily. So that's also something that you can work with in this arena of deep work. So your goal, a feasible goal, is to stop picking. That's perfectly fine, but never to feel stressed, never to feel anxious, never to feel the urge. Those goals might be unrealistic. Instead, it is a much better way to develop the skills for those precautionary measures, such as learning how to tolerate these feelings once they appear. When I assign this relapse prevention session to our clients in the program, one thing that I often get as a question is all this truly necessary? Like, people will tell me, this is just picking. Why do I have to, alter my entire life, incorporate all these habits into my everyday life, change my routine, change the way I work, change the way that I relate to my partner or my friends or my coworkers? Like, this is just picking. Is this all really necessary? The short answer is obviously yes, otherwise you wouldn't be working on it. But the longer answer would be that I think it is a mistake to think of picking or any symptom whatsoever that you might have as being this ordinary thing that bears no relation to other parts of your life. A symptom is always a function of our psyche and the environment in which we are. So if picking is a way for you to avoid processing certain difficult thoughts and emotions, then whatever causes those thoughts and emotions is on the table to be changed, as well as your relationship to your emotions. So whereas picking might seem like a small problem in proportion, although I seriously suspect that most of you think that, it is just something that I do encounter, so I feel the need to address it. Then picking is sort of a symptom of a wider problem, which is not tolerating and not knowing how to understand and deal with your feelings. Can you go through life and live a healthy and happy life without knowing how to deal with what is a huge chunk of your everyday experience? Well, I don't think so. And in those situations, I think if picking goes away, something else might come along. I've had a client who started the program. Well, one that came to my mind now, but more when I think about it. And this client that I'm thinking about, because it was a recent client, so she joined the program and she did only the habit reversal part, so the behavioral part, where you just substitute picking with something else. And then she kind of decided to stop the program once she finished this, because she was really very diligent, very efficient, and she found techniques that almost completely eliminated her picking. And she said, that's all I need. I'm going to stop the program now. So I said, I don't necessarily think that's a good idea, because you have replaced picking. That's fine. So you're not picking. That's excellent. But there are more layers underneath that are just lurking and waiting to come to the surface. And she said, no, this is your mistake that you think that there's more to picking than just being a habit. And I said, okay, fine. It is what it is. My clients have the right to make their own choices, and it's not up to me to tell them what to do. So this client quit the program, and a couple of weeks later, she emailed me asking if she can come back and if we can continue our work together, because she started developing panic attacks. Because when you use picking to process your anxiety, to avoid processing your anxiety, and then you take away that only mechanism that you have to somehow deal with anxiety, even if it's not very healthy and functional, that anxiety is bound to come out in some other way, because you didn't address the source of anxiety or even your relationship to anxiety. So is all this necessary? Maybe not for everyone, and maybe not all, but some or many of these for all of you, for sure. So mindfulness is something that you can never have enough of, problem or no problem. If you live a mindless life, it's not likely to be a fulfilling life. So that's a kind thing to do for yourself. On the other hand, maybe you don't need many of those self-care routines. Maybe you just need one. Maybe you need to emphasize more how to use those precautionary measures to deal with triggers. Maybe you have a trauma that you need to work through. So you don't need to have all of these. I mean, we don't need to have all the problems in the world, but don't shy away from going deeper, because as efficient as CBT techniques are, they have one flaw, and that flaw is that they only deal with this, let's say, the surface. Sorry, let me just move my webcam a little more, because my chair decided to lower itself, so I'm barely visible. So CBT techniques, especially behavioral techniques like habit reversal, they're excellent to manage symptoms, but they don't touch the causes. You can't deal with trauma, through habit reversal training. Trauma requires really very patient work. It requires a lot of internal adjustments. It requires redefining relationships to some very vulnerable parts of yourself. Perfectionism is almost always related to very poor sense of self-worth. And this is not, there's no life hack or a trick or a one meditation that is going to make you love yourself after 5 minutes. So these are all things that require a lot of work and long-term work, and things that ultimately do affect other areas of your life as well. You can't have low self-worth and only have it reflected in picking. So in that sense, a symptom is just a function of something else. It's a patch on a deeper issue. Think about it that way. So don't shy away from making big changes, because by focusing only on the behavioral aspect, I don't think that you're doing yourself a big favor. That aspect is important, necessary even, but you're not doing yourself any favors with it. Okay, so this is all I had for you today. I see some of you are asking for the balls. So they're called the Baoding balls, Baoding balls, BALLS. So that's how you spell them. Or you can try typing Chinese meditation balls. I think the same thing will come up, but they are called Baoding balls. So if you have any questions about this webinar, because my throat hurts even more, I really cannot do the Q&A session entirely. Please email me your questions to support@skinpick.com. Also, if you want me to send you instructions on how to make a self-soothing kit, if you want resources on self-compassion, cognitive diffusion, any of the things that I've mentioned, I will create one list and I can share that with you, including the guided meditation that I mentioned as a first aid technique. So I can send you all these, of course, needless to say, for free. Just email me at vladimir@skinpick.com. And I will send them, if you email me today or tomorrow, I will send it to you tomorrow. If not, then I'll send it on Monday. Another thing that I want to make sure that you see is that usually we give a discount code for people who attend the webinars. So this month and last month, they've increased the discount. So now you get a $100 discount for the first month, which is, I think, around 50%, a little more. So the code will be ProWeb100. So remember to email me, screenshot or write down my email, and I will send you all the resources and answer any questions that you have. Thank you. Sorry. Thank you all so much. Oh, 1 second. Before you leave, I need to close the poll so that I can see what our topic will be for next month. Okay, so let me see. So we have a tie between two things that I don't quite know how to reconcile. So one is self-worth, self-compassion, and skin picking, and the other one is stagnating on the path to change, what to do. So would you like self-compassion or stagnation? Type your topic of choice in the Q&A. So whoever types it first breaks the tie, and that's what we do next month. Stagnation it is. That was very quick. So we'll talk about what to do when you start changing, you achieve some progress, and then you can't seem to move forward. You know, what stops you, what can move you forward. So that's what we'll be talking about. Thank you all, and have a pleasant evening. And remember, if you want me to send you the resource list, just email me. Thank you again, and have a nice day. Bye.